with Dr. Frances Edwards answering the additional questions that we simply didn't have time for during our webinar, Transit and COVID-19, how its impact differs from other emergencies. Starting with question 1. Even though transit agencies are already taking extra measures to clean the interior of the bus or train, when it comes back to the division, what other measures can be done while the bus or train is in service, and what other methods can we do to protect our operators?
The American Public Transit Association is going to be holding a webinar tomorrow on April 16th with the CDC to provide some more in-depth information about post-opening steps that transit agencies can take. And if you miss the webinar, it will be available as a recording for APTA members. But for those of you that are just looking for some quick tips, many of you may already be doing these things, but you can tape alternate seats on alternate sides of the aisle to prevent people from sitting close to each other. And you can also mark the floor with tape showing 6-foot spacing so that people have some idea where they can stay. We also think you could encourage passengers to wear masks using your movable signboards that are part of your trains, and encouraging them to use gloves in the transit system. And you might provide hand sanitizer at the station exits to encourage people to clean their hands, clean their gloves as they leave the transit facility. The other technical item that you may be able to do something about is the air handling within your vehicles. So CDC is encouraging all employers to increase the number of air exchanges per minute in their system. So if it's possible for you to enhance air circulation in your stations, your trains, and your buses, that would also be very beneficial.
All right, number 2 is a two-parter. Are transit systems able to maintain social distancing with smaller trains on regular service? Is there a recommended number of riders per car on systems in order to maintain sufficient distance? Followed by, how does public transit enforce the 6-foot distance between passengers during rush hours in buses and trains? Who will monitor, control, and enforce social distancing? And once the pandemic is over, will buses continue as usual with overcrowded cars?
Well, some of those things are going to require a little bit of a crystal ball. But the first one is that the number of people that can safely ride on a bus or a train will depend based on the product that you're using. So my best recommendation would be to have your staff take a tape measure and figure out how many 6-foot apart spaces there are, both in the aisles and in the seating, and then encourage drivers to try to limit the capacity of the bus to that number of people. If you're discovering that your drivers say that their buses are filling up quickly and they're having to leave passengers behind at stops, that might be a clue to add additional buses to that particular line or service. It appears that the reopening of the economy is going to go in stages. So I think there will be opportunities for buses to be incrementally added to routes or removed from routes if they're not being used. So how do you enforce the 6-foot distance between passengers during rush hours on buses and trains? Well, I don't think enforce is exactly the right word. I would say facilitate. And that's the same answer. You would provide a little bit more capacity, an extra car on a train or an extra bus on a route, until you can find the balance between not overcrowding the bus and not running buses empty. This is obviously a fare box issue, but there is some funding to help with the management of some of these losses, and each agency will have to decide for themselves where they're going to balance passenger service with cost of providing that service. So my answer to the next question is nobody is going to try to force people to do anything. You don't want to do anything that will cause dissent or make people angry or result in people having face-to-face negative interactions. That would be much more dangerous. So I think you can use your signage in the buses and in your stations to remind people, maintain 6-foot distance, seek a car that is not already crowded, messaging like that, to just encourage people to use their common sense. Honestly, once people begin routinely wearing masks, if everybody in the car has on a mask and people are not quite 6 feet apart, it's probably not as critical as if their faces do not have masks on them. That would be very critical. But the purpose of the mask is to keep people from spreading their germs to others. It's to keep your germs against your face. So if everybody is doing that, it would greatly minimize the likelihood of spread, even if people were only 4 feet apart. Of course, you want to avoid having people shoulder to shoulder or sharing seats, because that could result in transmission. Once the pandemic's over, I think it's going to be difficult to imagine what is going to happen. Will everybody go back on the transit immediately? No. First of all, we're going to have a rolling opening. So you won't go back to business as usual on February 1st, the day that we open, if it's May 6th or June 1st or whatever day it turns out to be. Everybody won't be allowed to go back to work at the same time, and not everybody will want to go back to work at the same time. So I don't think that for most cities, immediate crowding is going to be an issue, and I think it will give you some time to plan and see what your ridership has become, and then make judgments about adding a car or adding a bus. On the other hand, in cities like Washington, D.C., and New York, and perhaps Chicago, where trying to drive around the city is very, very difficult. You may find that people return to transit much more quickly. And again, people are going to be asked to wear masks and gloves once the opening begins. So some of the danger will be mitigated if people do, in fact, wear their masks and gloves. I think you have to plan according to the usage of your system, whether you think you're going to see an immediate surge of demand, or whether a lot of people are going to stick with their private cars or still work from home.
Number 3, will prolonged social distancing recommendations affect returning ridership levels? How can agencies best position themselves coming out of this pandemic with an already skeptical public? What should transit agencies be thinking about if and when we move to the recovery phase of this pandemic? Are there any new studies that may jumpstart transit once COVID-19 restrictions are lifted?
So again, you're asking me to gaze into my crystal ball, which is pretty cloudy right now. But based on what we know from past experience with other kinds of emergencies that impacted ridership on transit, prolonged social distancing is probably going to be required, and it may deter some people from wanting to ride on any public transportation, no matter how well spaced their seating or standing space might be. I'm not sure that you can do anything about that as an agency. I suppose that you could use your signage to encourage people if you feel like you're not getting a response from the public on their own. You might remind people that it's safe to ride the bus. You might start some messaging now that says something like, we're preparing for your return. We have capacity to provide you with a safe space. Please come back to transit, something like that. But again, their likelihood of responding to your message, I think, is going to largely be driven by traffic patterns and convenience, and a little bit by fear. I think the first rollout is going to be gradual. Certain people are very anxious to get out of the house, but if their children are not back in school, they're not going to have that option. So when you think of all the people in your community who are going to still have to be homebound because of familial responsibilities, and those people who see that they have other options and prefer to take them, you're probably not going to have the full complement of your potential passengers for several weeks or even several months. I think when school goes back in session, that's when you will see the big increase in your probable ridership, so that now that parents can go back to work, and most of them will be very happy to go back to work, they may look to transit as an option. And once the children are in school, they may need the bus service at the beginning and end of the school days. So I would be thinking about those kinds of stepwise increases and changes in service. Especially be sensitive to your large employers and whether or not they're going to continue having people work from home for extended periods of time when they're planning to open their facilities. I would suggest that once the governor announces when the first people will be allowed to leave, you take a survey of the businesses that will initially be impacted and ask them what their plans are in your community. If a few small restaurants reopen, that won't have much impact on your ridership. On the other hand, if you have a big employer like we have Google here in Santa Clara County, and Google suddenly announces that tomorrow everybody is invited to come back to work, then that could have a significant impact on the transit that serves those facilities. So I think if you use some time to plan ahead, understand your particular community impacts, and match that up to the routes that you have that serve those community areas, you can make a guess, an educated guess, about the kind of service that you will need. And I would say if you can possibly afford it, over-prepare. Add a couple of extra cars to the light rail. Add an extra bus or two to those routes that you know are going to have an increase in ridership. And if after a couple of days you find that the buses are running with 2 or 3 passengers, then of course you would decrease back to your COVID time service levels. But if people try to get on the bus and they see that it's crowded or they get left behind at the stop, that will discourage them from trying again. So when you open, you want to be sure you have enough capacity to meet and maybe a little bit exceed the need that you think will be there. So I think that kind of moved us into the recovery question as well. As far as funding, I have no information whatsoever that there will be any additional subsidies coming for transit. Congress is not in session right now. Most of them are home in their districts. When they come back to Washington, and I don't know when that will be, I haven't heard any reliable reports about that. But once they come back in session, they are supposed to be taking up yet another CARES Act, as they're calling them, that will address some of the issues that weren't addressed in the last and are supposed to be looking toward recovery. However, that's all speculation at this point. I think, again, APTA would be your best source of information about whether there's any potential for funding. I know they have a group that's been working very hard on representing the concerns of transit to our elected officials, and they've been very effective in the past and successful in getting some funding. So I'm hopeful that we'll see the same outcome from them in the future. I know they're trying very hard.
Will the potential increase in work from home situations reduce the excess pressure on systems by reducing traffic and the need for mass transit? Or would it reduce ridership past the point of sustainability? Is there a possibility public transit could stop completely if the pandemic worsens?
So again, you're asking me to get out my crystal ball. My belief is that a lot of people have found working from home quite pleasant. And they may continue to work from home if they're permitted, maybe not every day, but perhaps several days a week. And so I think that the combination of the slow rollout of the recovery and the opportunities to work from home for some people may result, at least initially, in a lower peak demand level than you saw on February 1st. But I don't think that that will go on indefinitely. I think there are probably some industries that will switch to working from home much more frequently. But a lot of people have to be present in their offices to do their work. And I know that our large high-tech industries here went through a phase in the downturn where they tried having people work from home to cut their costs so they didn't have to pay for HVAC and so much energy and water and things like that in the buildings that they owned. And they discovered that there's a synergy of having people in the workplace together. that while there are certain efficiencies in working from home, the level of creativity did not seem to be as high. People need to bounce their ideas off somebody in a more informal way than trying to set up a Zoom at 2 o'clock tomorrow. So I think that a lot of industries will choose to have people come back at least on specified days. A lot of big businesses like department stores and malls have to have face-to-face transactions in order to have enough business to stay in business. So I think you'll see a surge of interest in people going back to those places for work. If the large businesses open up, then the people who ride your service will be stimulated to use it again. And that can include people who don't own a car or who don't have access to a car every day. So I think that that may be helpful. I don't think it will reduce ridership past the point of sustainability in the initial days of the reopening, because it will be a little more than you have now, and in each phase it will add a little more. I don't think there's a possibility that transit will stop completely if the pandemic worsens, because essential services still have to be provided. We have people who are in hospitals. They need all the workers there. We have special hospital type facilities that have been set up in hotels and motels. And so those employees have had to go back to work. So we've actually, even during this crisis period, seen a slight increase in the kinds of people who are deemed essential and who are going back to work, or whose workplaces have expanded. Like here in Santa Clara County, they set up an entire convention center as a hospital to relieve the pressure on the public hospital. So those have increased the demand for access to work. Now, whether that's stimulated people to take the bus or whether they used a private car, I don't know. I haven't seen any surveys. Nobody really is in a position to do much field research right now with the shelter-in-place order. But I think that it's unlikely that transit would shut down unless you run out of operators. And that doesn't seem likely, because we've already had in every agency that I'm familiar with, some operators who've become ill, sheltered in place at home, recovered, and are now ready to come back to work. And as I said during the webinar, the CDC has provided guidance for agencies on how they can get their employees safely returned to work. And it requires them taking their temperature before the start of the shift, increasing the frequency of cleaning for commonly touched surfaces, doing more to increase air exchanges in the building, and testing the use of face masks and gloves as a way to provide additional protection. So I think if US systems follow those back to work guides for the people who've been ill and are returning, you'll maintain a reasonable level of employees to operate your system. The challenge will be whether they're properly spread across the types of work that you need to have done, because you require special licensing for each type of vehicle that's operated, and you have people who need special skills to run your financial systems, for example. But at this point, at least in California, we seem to be seeing something of a leveling off of new cases, which might suggest that we are going to hit that flat point on the peak, where it may not get a lot better, but it's not going to get any worse. And then hopefully that will allow us to begin to gradually go back to work and not have to worry about transit stopping completely. On the other hand, a lot of systems have greatly reduced their service. I heard a speaker from the City of San Francisco's municipal service talking about the fact that they were guaranteeing that everyone in San Francisco had a bus within 1 mile of his or her home. And that's a lot further than was the case during typical service levels.
5, do issues of accessibility for transit-dependent people go out the window with COVID-19? Or should our attitude be that these people should not be traveling during the pandemic?
I'm going to assume that is really an ADA question, that you're asking about people who need accessible transit and whether they still need to be served. And I think that COVID-19 does not change the requirement to have ADA accessible transit available for those who need it. There are many people who need accessible transit for a variety of reasons who are perfectly capable of going to work and doing the job that they normally do. And if they're in an essential role at a hospital or a transit agency or a critical service, then they need to get to work just as they always have. And some people who have limitations such as visual impairment or hearing impairment really don't have the option of driving themselves. And so they're going to continue to look to public transit as their principal source of movement from their home to their job. And it's critical for all of us, for the economy and for the services that we need, that that remains available to them. Of course, people who are calling up and asking to be taken to non-essential activities should simply be told that that service is not available during this time because those activities are not occurring. Bingo and the hairdresser are both closed.
Individuals may be afraid to use public transit after this pandemic. Is now the right time for cities to launch new but potentially disruptive technology? For instance, high-capacity public transit is possible with small vehicles on privately funded elevated fixed guideways nonstop between widely distributed small economical stations.
I think it's always a good time to be thinking ahead for disruptive technologies that could improve our public transit. But I do not see in the near future anyone coming up with funding, whether it's a public or private source, for something as innovative as small vehicles on elevated fixed guideways. We are in one of the worst economic recessions our country has ever faced because so many people are not allowed to go to work. I think it's going to be some time before our economy is restored to the point where we can think about new capital investments in new innovative technologies. So I would not discourage anyone from these types of plans. And certainly if you have an advanced planning unit that can look at this kind of work and begin to develop plans that are shovel ready, at some point in the future, I imagine we're going to see another economic stimulus that's based on infrastructure development like we had during the Obama administration. I think one of them was called Tiger. And I know that BART to San Jose extension benefited from some of that funding. So if you are a forward thinker and you have done some advanced planning, if you can afford that investment of your staff time and you're ready with areas where you need to buy right of way and the types of equipment that you would need to order and have built and the type of rail that has to be poured for you, then maybe you would be considered shovel ready and be able to get some of that funding. But right now, I think it's always a good time for forward looking and planning, but my time frame would be a lot more like 6 weeks or 6 months or 1 year. How am I going to handle the rollout? How am I going to manage recovery? How am I going to keep my business in business while this is going on with greatly reduced fare box, dramatically reduced sales tax, and practically no gas tax? I think that's a much bigger challenge. And providing service in alternative ways can certainly be undertaken using vans or smaller buses or single car light rail, but trying to create something entirely new, I think would be a big economic challenge in most parts of the United States.
Does COVID-19 negate fully-fledged activation of FEMA and ICS structure? Would ICS be more effective at a more equitable, need-based supply distribution?
So I have to kind of back up a minute before I can answer this question. I'm not sure everybody on the call is familiar with these acronyms, but the Incident Command System was developed by the Fire Service and it's used at the field level. It's used day to day by every fire department in the United States and by most emergency medical service, a lot of law enforcement. So at the field level, to the best of my knowledge, ICS is in fact being used every day at the field level by everybody who's involved, whether it's the Coast Guard, the National Guard, our local and state first responders or the medical system. The medical system actually has their own version of ICS called Hospital Incident Management System. And HICS, Hospital Incident Command System, HICS has been in place for a long time, since we had earthquakes here in California, and one of the hospitals in Orange County decided to just bring ICS indoors. So it has a long history. And the hospitals I'm familiar with are using it to run their internal structures. They have EOCs open. They use them to coordinate things like bringing in staff, bringing in supplies. So that's all in place, and at least in California, it's running that way. Now, when you move up to the state level, and in California, we use ICS at every level. So our state operations center, which shows on the TV when the governor gives his talks, is all run exactly by the incident command system brought indoors, which we call the standardized emergency management system. So at least in California, that's already in place. And that is what is coordinating the distribution of personnel, the distribution of goods, the purchase of needed supplies, supporting all the initiatives that you hear the governor talking about to help to support first responders and medical personnel, the community, and all of the services that we need. So I can't speak for other states. I'm not familiar with all of their structures, but I know definitely within California, we have gone right up to the governor himself using our SEMS system. Now, when we move to FEMA, we have to remember what the National Response Framework says about disasters. All disasters are local. They are managed at the local government level. The state supports the local government, and the federal government supports the states. So understanding that FEMA would never run on ICS because it's not a field response agency, they do have the emergency support functions, which is their framework for organizing their emergency operations center. ESF1, as you all know, I'm sure, is the transportation function run by USDOT, and that's where we see FTA, FRA, and the other federal partners very active right now in providing information, research, support, helping with funding, helping with training for all of us who can go and listen to the webinars that they're providing. But we also see a new emergency support function, ESF14, that was just issued in October. So it really is very new. And it is called the cross-sector ESF. And unlike ESF1, which is all about transportation, ESF14 crosses all sectors and is intended to bring the private sector, the nonprofit sector, the educational sector, everybody into the same room so that we look at who has the resources and how they can be applied to the problem, how they can answer the governor's call for assistance. So I think it's fair to say that FEMA is in a fully fledged activation. They are certainly using the National Response Framework. They are using the different ESFs to support transit, public works, public health. We see them all in the field. We see the mutual aid that has been provided through FEMA's coordination. We see the goods that have been purchased both in and outside of the United States through this cross-sector coordination. So I think that what we have now shows us the kinds of systems that do work. Unfortunately, they don't all get stood up at the same time. Not everybody who's called into work has been properly trained, and so sometimes time is lost while people learn on the job the skills that they need to do their work. So the slow ramp up is not surprising, but I think that at the present time, we are looking at a structure that's in place to try to provide more equitable and needs-based supply distribution. This has actually caused a lot of press right now where governors complained that they were trying to buy PPE, personal protective equipment of some kind, and they put an order in with a company that makes it, and when it was their turn to take delivery of their materials, instead they were told, oh, we're sorry, the federal government confiscated those. They came off the assembly line and they came and took them. So you're out of luck. Well, the federal government isn't taking them for themselves. They're taking them to put into this ESF-driven supply chain, which in turn distributes the goods based on decisions that are made in the National Operations Center, which is part of the National Response Framework. So it's the plan that's been in place for a number of years, most recently reissued in October of 19. But that's a standing national plan that's being used. And it means that priorities are set in the National Operations Center that may not suit the priorities of every state in the United States, but they have been using as one major priority those areas with the highest outbreak rates, the highest death rates, and the highest number of people who are severely ill or who have died. So you look at the fact that certain places like New York seem to be getting disproportionate service, but they have a disproportionate number of people who are ill. So I'm not privy to all the decisions in the NOC. If any of you are, perhaps that's information that could be shared through APTA, but that's my understanding of how the system is working now, which is the way it's been designed as long as we've had the post 9/11 structure in place.
Will funds currently set for transportation projects such as high-speed rail or Senate Bill 1 funded projects be redirected in response to COVID-19?
My only comment to you is it would require an act of the legislature, and in some cases, it might require also direct democracy here in California, since a lot of our transit money has come through a variety of propositions that have been voted on by the people. But my understanding of Senate Bill 1 is that the money has specific streams through which it can be spent. So the money that was always intended to come to transit was intended to come for specific purposes. It would take an act of the legislature to change that purpose. So for example, if there was money coming to transit that was intended to increase capacity or modernize equipment, could that money be used instead to make up fare box revenues that were lost by COVID-19 shutdown? That would be up to the legislature. At the current time, I don't think there's any possibility. And as far as high-speed rail, my understanding is that they don't have very much funding right now, and the funding they have is committed to the capital project that's already underway, building the railway between two Central Valley locations, Bakersfield, and I believe it's Merced. So that money is tied up in existing contracts, and that would take significant interaction of the governor and the legislature to bring about any changes to that.
How are USDOT and FDA civil rights regulations affected by this immediate danger to the health and safety of others?
So unfortunately, we don't have too much elaboration on what the writer meant by the USDOT FDA civil rights regulations. So I went and tried to research what the specific issues might be. And so one, of course, is equal access, and that does not change. And as my earlier comment alluded to, the provision of ADA services still has to continue because of the ADA law and the civil rights regulations of both USDOT and FTA. One of the things that's going to cause a big challenge under this element is the taking of the temperature of employees when they come to work. And this is going to be one of the requirements when the rollout begins, when people begin to be allowed to come back to work. at least in the initial phases, every day before anybody's allowed, as I understand it, in the building, they're going to have their temperature taken. So we don't have very much information right now about exactly how that's supposed to happen. Who's going to take their temperature? What technology is going to be used? Will people be given priority, say operators first because they have to be in their desk by a certain time to provide a service to the public versus someone who's doing, let's say, clerical support work who is supposed to be at their desk at a certain time, but if they're 15 minutes late, there would be no interruption of service to the public. So I think that how that's managed is going to have to be carefully structured to be equal and non-discriminatory in the way that it is set up, while at the same time trying to provide reasonable accommodations for people whose work literally starts at a certain time, like operators, dispatchers, people in the call center, positions that have to absolutely be 24/7 staffed by licensed, trained, and certified individuals. Another issue that is likely to come up is the challenge of dealing with people who are returning to work because they have recovered. So how are you going to treat the people who've recovered from their disease? Is there any different setup you're going to do for their work location? What about a bus driver who's returned to work after being ill? Is that driver going to have to wear a mask? Are all drivers going to have to wear a mask? So these kinds of personnel issues need to be dealt with. A plan needs to be made before these situations begin to arise. And given that CDC gave the instructions 5 days ago now, I would think that you could start to see recovered people returning to work even by now. Another problem will be, how are you going to deal with people whose test shows that they are positive for COVID-19, but they were never sick? They never had any signs and symptoms of the disease. Do we know whether they're super spreaders who never were sick but are contagious? How will we figure that out? Will they be treated any differently from the perspective of being get back to work, being able to be paid? What about when their sick leave runs out? Will they still be forced to stay home because we can't tell why they're positive and asymptomatic and whether or not they're contagious? So these are a lot of issues that are medical issues that I would recommend you consult with your public health officer and get an official letter from your public health officer telling you how to deal with people who've tested positive but never been sick. And then what about the people who are still testing negative? Does that mean that they have never been exposed, and so the first time they are exposed, they're going to get sick? Could that be a liability for you in the workplace? On the other hand, if they've still not tested as having any antibodies, does that mean that they have some other antibodies that have prevented them from becoming ill with this disease? Again, these are really questions that you should deal with your public health officer about, and you will not be the only industry asking these questions or needing these answers. So I think the sooner you formulate a list and make contact with your public health officials to get their response, the sooner that you will be able to organize the return to work for your agency in the most fair and equitable manner under the law.
Can we see an example of log sheets, and who should be turning them in during this event?
So I've provided an example of a log sheet. I don't know if that can be shown. Thank you. So this is an example from the agency where I have the most consistent relationship, and that's with the Valley Transportation Authority here in Santa Clara County. This is the log sheet for their Emergency Operations Center, and it gives a good example of the types of information that log sheets should contain. So you need the date and time, you need some sort of tracking information, either a message number or the place that it was sent, if it's a message. And then you need a description of what you are trying to record here. It's very important that you identify at the top the section and name, but also the name of the person who's filling out the sheet, and then what incident this is tied to, which is COVID-19. So the types of information that need to go on this sheet are a log of major information that you received while you were in the EOC. So when did you hear that there was some sort of a change in your community? When did you learn about a new public health order? When did you learn about a change in your own agency's capability to provide services? What about information that was given out by the president or the governor that had some impact on your service? And then what decisions did you make? Did you recommend the reduction of service? Did you recommend a change in the way you were dealing with your personnel? Did you recommend a change in the way the EOC was organized, the Emergency Operations Center for your organization? Did you recommend bringing in more people? Did you recommend going completely virtual? Did you recommend holding Zoom meetings for action planning? Those types of major decisions. Also, anything that you do that's going to cause money to be spent. So if you requested a contract, if you requested a purchase, that all needs to be recorded. Why? Because when FEMA comes to audit your request for reimbursement for the things that you bought for public safety purposes, for the things that are covered under the COVID guidance, you have to show what triggered that purchase. You didn't just go out and buy more gloves to have them at a storage location. You bought more gloves because there was an order from the president or an order from the governor or an order from your public health department. And that has to show up on the logs of the people who were involved in thinking about the problem, making a decision about the problem, giving direction about the problem, spending money to resolve it, and so forth. So if you think of the chain of command and the chain of events, they all have to align. You have to, as they used to say, connect the dots, so that from the governor saying we all have to shelter in place to you ordering your first staff to stay at home, what was that chain of events? And ideally, all these things should be done in real time. However, I realize for some of your organizations, you may not have had adequate information to begin at the beginning. So certainly start where you stand. At least during the rest of the response and during the recovery, you can document what you've done. And maybe there's a capability to go back and reconstruct some of the major decisions that were made and when they were made, so that they are tied to decisions you made about spending money.
What steps should small businesses take to overcome the economic hardships they are facing during this pandemic?
I think the first thing that the small businesses should do is take advantage of the current Small Business Administration loans that are available to all small businesses. That's normally defined as businesses with less than 1,000 employees. So it isn't just a mom and pop with 5 people. It can be a fairly large supplier of goods and services to your agency who has 450, 550 employees. So there are different amounts of money and different loan conditions for different size organizations, but everybody who's potentially eligible should apply, because that funding can be forgiven. It can become a grant. And for a lot of small agencies, that might make the difference between their ability to stay in business and continue to provide services to you or your patrons, if you have stations where you have small businesses that operate a restaurant or a newsstand. Those services are important to you as part of your milieu, as part of your riders' appreciation for transit. Keeping them in business matters. So if they get the Small Business Administration loan and they keep their employees on the payroll, it will carry them through some of the costs of this hardship time and maybe allow them to keep serving you and the community. Other than that, I think doing as much as they can to continue to provide services remotely, the takeout food for restaurants, for example, is a possibility. But if you have a newsstand where you sell newspapers and candy and chewing gum to commuters, there are no commuters that are likely to be coming to your shop. It's probably not something that can remain open at the present time. So these loans may be their best hope for staying in business. I do think that if there are small businesses that you patronize regularly, a catering service, for example, that normally provides food for your meetings, or a small business that provides IT services, or anything that you deal with on a regular basis, it might be valuable for you to communicate with them and let them know that you value them, that you hope that they will reach out to the SBA for possible financial assistance, and that you look forward to working with them again when times are better. Because that kind of encouragement might help some of these small businesses make the decision to try to hang on for another month or two. Whereas if they never hear from anybody, they decide nobody cares that we're gone, they might give up.
Are there any upsides for those essential workers currently using transit?
I think the main upside is less crowding. So they can make their normal day-to-day trips and not have to worry about finding a seat or finding a place to stand that's comfortable. That's kind of thin benefit, considering the inconvenience that a lot of the schedules have changed, and so people are having to wait much longer to get their bus. They're having to readjust their work schedule so they can be sure to be on the platform by 9 o'clock to catch the last BART train, for example. So I think it's always good to try to find something positive to say, and I think safety on the transit system has never been greater. We've seen all kinds of crime go down, but it's really hard to be a pickpocket when you have to stay 6 feet away from people. Running on the train and grabbing somebody's phone is a lot less likely to be a successful criminal enterprise than it was when everything was crowded and people couldn't tell who was where. So maybe those are the two best things you can say, less crowding and a drop in worry about crime.
Will there be an increase in remote working opportunities once the economy recovers?
Well, again, this is a crystal ball question, but my discussions with my colleagues around the United States leads me to believe that there's going to be an increase in the number of higher education classes that will be offered online, that will be offered using Zoom technology, if not every class, at least some classes, to lower the amount of person-to-person coverage. I've also heard a discussion that higher ed might go to a system where a third of the class comes to the classroom and sits 2 chairs apart, and the other 2/3 listen by Zoom, and that the people who come to class rotate. So a third comes this Monday and a third comes next Monday, and so forth. So all those kinds of changes would have a significant impact on ridership of the services that reach higher education. So I teach at San Jose State. We have 34,000 students and another little less than 2,000 employees who commute every day to the school, and a significant percentage of them do use VTA services. So if we go to one of those systems where we have rolling groups of students who come, that might limit the number of people that take VTA. Because one of the main reasons my students take VTA is they can't find any place to park if they drive their car. Well, if only a third of the people are coming to campus, parking won't be a problem, so they won't take VTA. So I think there's a lot of unknown unknowns. It's hard to sit here and even imagine what kinds of changes might occur. As I have mentioned, a lot of my neighbors work for the high-tech industry, Google, Facebook, Yahoo. And of course, social distancing means we don't chat with each other very much, but we do have front porches. And so a few of us have had conversations from more than 6 feet away off of our front porch. And the consensus among my colleagues out here, my neighbors, seems to be that there will be a period of time when high tech will take the same approach of only wanting a small portion of their workers to come to work at the same time and having most of them staying home. And so maybe people will just work from the office 1 day a week, and then 4 days a week they'll be at home. So these are the kind of trends that you'll want to talk about with your local business community. And I think you might try reaching out to your Chamber of Commerce and seeing whether they've had a Zoom call discussing this issue among the business community. And if not, that might be something you could encourage them to do, and then ask if you could be a listener to hear how different businesses are looking at their immediate futures. In the long run, I think there will be some higher education, some office work that stays as a work from home on a regular basis, maybe 4 days a week, maybe even 5 days a week, with just seasonal meetings or monthly meetings in person. So this all remains to be seen. But if you're in a big congested city like New York, Chicago, Philadelphia, Washington, D.C., Atlanta, I don't think that the job changes are going to be enough to cause a significant lack in demand for your service, but you're going to be running vehicles with many, many less travelers than you need to break even. So that will be the challenge of the future, is do we really want public transit, and how do we want to pay for it? Should it just be a public utility that we all pay for with our taxes, and let all the riders ride for free, as most organizations are doing right now?
Should companies be taking current action to safeguard their employees against continued spread of germs and viruses once the shelter in place is lifted? Should companies be installing plexiglass expansions to cubicle walls?
So this is really a technical question, and I did look up some information about HVAC systems, heating, ventilation, and air conditioning systems. Most of us work in buildings that are sealed. So we depend on the HVAC system to be able to stay indoors. The CDC is recommending that the number of air exchanges per hour be increased in all buildings as people come back to work. That air exchange capability is based on an air circulation pattern that is created by the existing furniture, partitions, and placement of other kinds of impediments to airflow. So if you go in and start installing plexiglass, you're going to change the airflow dramatically, and you might end up with stagnant air in most of your cubicles. So before you make any kind of changes to the air circulation, I would highly recommend that you hire an engineer who's a specialist in HVAC system design, and have that person come into your building and evaluate the air circulation pattern that you currently have, and discuss with him or her what you are thinking of doing to enhance the separation between employees, and see how that might or might not generate unwanted changes in your overall air circulation patterns. Once you know what's doable, then whatever makes sense for your organization's existing infrastructure would certainly be a good idea. But I think for most modern buildings, the answer to putting in new partitions is going to be no, unless you're willing to invest in the rather expensive proposition of adding many more air exchangers throughout the floor of your building. And I think for most people, that would be prohibitively expensive. A much better strategy is to buy cotton face masks to distribute to your employees when they return, and give them 2 or 3 and make them responsible to keep them washed and clean, so that every day they have a clean face mask for the day while they're at work. Wearing a face mask is not necessarily pleasant or comfortable, but if people are working in spaces like control rooms or office spaces where there isn't a lot of opportunity to create more space between people, then wearing the mask will be critical to everybody's health as we slowly make our way back to work.
With that, we'll conclude our additional Q&A session for transit and COVID-19, how its impact differs from other emergencies. Thank you, Dr. Edwards, for your time.
Thank you.